So this is an English-speaking session. It's called Europe's Innovation Crossroads, and it's in somewhat semi-hybrid format because we have the General Director of the European Federation of Pharmaceutical Industries and Associations, Natalie Moll, online. She's already online, so great. Mr. Oliver Bleck from south part of Europe and Roche company, professor of the Department of Health Policy and director of MTRG and LLC Panos Kanavos. Good morning. And Cyril Siver, Senior Vice President of International Strategy. I would like to welcome you on board on this, let's say, more specialized session about how pharmaceutical industry somehow plays out in the discussion about resilience and all the geopolitical turmoil that I think that we briefly touched upon earlier with Professors Phyllis and Vetas. But first of all, I'd like to give the floor to Ms. Moll because she's online, and I think that we should give her the privilege to start speaking first because she's not here. So I would like to ask her on what extent does she believes that the current geopolitical pressures are accelerating existing challenges for all the research-based pharmaceutical companies in the area of Europe. Ms. Moll, we can hear you.
Kalimera, and I'm really sorry that I'm the only one not there this morning. I would very much prefer being with you in person, and thank you for making it possible for me to join you online for this important discussion. I think, as you said, it's a question of accelerating a situation that has been going for a long time. We now have various factors that are all summing up together. First of all, of course, the risk of tariffs that might disrupt supply chains. We have a policy in the US called Most Favored Nation, where there is an objective to reduce US prices by referencing them to comparable countries. And then there's also China's emergence as a global biotech hub. So this the shift is going towards more fragmentation, less globalization. And we can see already some impacts, but as you say, it's more of a increased emphasis on something that has already been happening. We published a few weeks ago our patient weight indicator that shows how long patients wait in Europe for the medicines, and the waiting times have got longer, but also we've started tracking approvals at the European level compared to other parts of the world, mainly the FDA, but also China. And we can see a declining trend in medicines approvals, approved by FDA and subsequently by the EMA, and a particularly steep decrease since October. So you could say Europe is becoming less and less attractive for the destination, as a destination for launching new medicines. And this is concerning for patient access, it's concerning for investment decisions, and also importantly for clinical trials. But as I said, it's a trend that's been going on for more than 20 years. We've lost about a quarter of our research and development in the last 20 years and halved our clinical trials. So I think the gap is getting wider. Our fragmentation, our slow legislation, the uncertainties that we have around pricing and intellectual properties are things that we need to address urgently. And then I would like to hand back to the panel. Of course, I think there are two maybe ways that we as an industry see that we could make progress together. One is a strategic dialogue. It's really time to make sure that member states, industry, but also the other actors come together and discuss this unique geopolitical situation we find ourselves in and find some solutions. And I know a number of ministers, including the Greek health minister, have had discussions recently together. And I think if we could extend this discussion beyond just the member states, but to include the actors, we would probably be faster in finding solutions together. And then think of a coherent package that could address some of the main obstacles that we see and improve conditions for investment, for innovation, for manufacturing, and for access. So I think these are two areas where we as an industry would see an urgent need for leadership, and we recognize certainly that Greece has played a very important role in underlying some key ingredients, and now we need to make sure that we come together and make the recipe the right one for patients in Europe.
So I would like to go to Mr. You believe that Europe, on an EU level, but also a national level as well, what can it do institutionally or otherwise to restore competitiveness? We already, Ms. Moll already touched. How does Europe become again a leading destination for research and development in the pharmaceutical area, of course?
I think what's important, and first of all, thank you for having us, and it's just great to come together and have so many stakeholders having that dialogue. I think it's this summit, year after year, is proving so important to really build momentum. On your question, I think it's really important to remind ourselves, and we say it, but I do believe it's important to just stress it, that science and innovation in what we do drives European competitiveness. I mean, science and innovation is at the center of what we do. There are very few sectors. If we look at the room, all of us in this room have to reinvent our business every 10, 15, 20 years maximum. That's a factor of intellectual property, but it's a factor of the speed at which science is going. So if we are to reinvent our business collectively in Europe every 10, 15 years, it's imperative that the entire environment, the framework, allows us to do that. And I touch on a few things. I mean, we've got fantastic science in Europe, but the speed at which it's going is very different in other regions. So we're really at crossroads, if you want. What we've seen over the last years, if you look at a few measures, whether it's publication, whether it's clinical trials, I mean, China has more publications now than any other regions. Historically, we had a lot of research in the US where United States were leading on the research side. Again, you see now China taking over in terms of the speed of discovery. So there's an absolute need for Europe to progress in terms of, and we talked about the fragmented element of Europe, to progress in helping move away from that fragmentation and set policies that are also rapidly adopted. You've got a number of, and I'm an optimist or positive, you've got a number of critical legislative actions that have been passed, whether it's Critical Act Medicine, whether it's the European Pharma Regulation, and I could name a few more, but the time that they're taking to be implemented and eventually executed in countries is just too long. And then those different elements of legislation need to be better connected. The second, really important element is linking that science to the purpose. The purpose is eventually delivering those innovations to patients. So we touched on it earlier. We'll talk about it, I'm sure, in the half an hour we have together. It's about how do we accelerate, once we discover something, its availability for patients. And what we see here is, again, we're in a very fragmented environment where we need to get our acts together in order to recognize the value that is being discovered and eventually make it available. So those are the dynamics that are so important if we want Europe to be competitive. And Professor Vettas, and I'll finish on that point, stressed also just the huge transformation happening with digital and AI. What was our reality a few years ago in how we reinvent our business is fundamentally changing with artificial intelligence. And here I may see an opportunity, but also a need to act very quickly. One of the things that we're particularly strong at in Europe is we're sitting, and many use that expression, on a gold mine of data. Close to 500 million people, patients eventually. And Greece is a good example of having put a lot of investment behind the ability to look at data, use data. But are we really exploiting what we call the European Union data space? Are we really making it a space where we can accelerate innovation and make the best decision based on that? Not yet. And eventually use AI to extract value. So there are clearly some opportunities, but we need to just move with much greater speed.
Mr. Siever, allow me follow up because you touched upon something I think it's quite interesting, which is the speed of the changes. I know because I come from a very different background that, for example, at war, technology in Ukraine changes every 7 weeks. That's the medium. Every 7 weeks they have to invent new ways of keeping up with what's happening on the battlefield. Are, let's say, not only on a European Union level and institutional level, the pharmaceutical industry very heavyweight industries to be self-reformed a little bit to follow up with the changes that need to be done?
There's a reality that you're touching on around the speed at which our industries transform and discover. But there's another reality, which is our regulatory environment. When you talk about biology, when you talk about patients and people, you need to be sure of what you're doing. So it's not only the speed at which we discover, it's our ability to, and that's why it takes a long time. It's not that we want it to take a long time. Is we need to go from multiple phases until we're able to make that discovery available in a safe and effective fashion. So that's the balance. Now, as much as we're looking to accelerate our discovery, and by the way, AI and the ability to combine biology and machine learning is just transforming how we discover, it is a reality that once we are able today to say, hey, this really brings value to patient, it takes on average in Europe 2 years for it to be eventually available to a patient. Mm-hmm. Mm-hmm. So I think we all, and that's why we come into those dialogues in this room, we all have a role to play, and we need to close those 2 years as fast as possible.
Great. So Mr. Black, from Roche's perspective, the European policy developments about clinical research, how the innovation in medicine moves forward, what's the position of your company? How do you assess those developments?
So good morning, everyone. For me, it's a pleasure to be here, and I build on the sentiments of the speaker. For sure, I think Europe is facing a very challenging environment, managing geopolitical tensions, the slowing of the economy, but also an aging population. We heard about being more competitive. We're not looking at this data for the first time. We've seen indicators over and over again. And I think Europe has a data transfer problem. As we look at certain signals and certain symptoms, it takes us too long to make a decision. I welcome the opportunity with the European strategies that we have in our hands now to come together, with the strength that we have in this room, but also across Europe from the life science industries, the policymakers, the patient organizations, research what we have, to keep a strong presence that we have in Europe today. 20% of the research in Europe is still sort of generating the research for the world. That's a massive footprint. The problem is this research doesn't reach European patients at the same pace than it does in the US, nor in Asia. And some of the medicines and innovations we develop come too late. And so let's look at this from an opportunity perspective. And while I know that a lot of governments facing fiscal pressures, for me, healthcare is always seen when I talk to policymakers as a cost or as something that you need to manage. I think health and health innovation is an opportunity to lead. I think the data that we have in our hands shows if you invest in health, you get better outcomes for patients. It's very clear if you treat a disease early, if you detect a disease early, the outcomes are better. The burden on the system in the mid and long term are less. You can also see when you do this, the impact on the caregivers and the overall society is less. So with every smart investment and modern medicine that you give to the right patient, you can actually reduce the costs in the healthcare system in the long term. It's also important to realize, we heard it, the life science industry is a big strategic sector. Right now in Europe, we have about 2.3 million jobs across the various companies in Europe. It's a very strong employer. The overall contribution to the European economy is around 300 billion each year. 300 billion euro, that's about the GDP of Greece. So it's a massive contribution to the economy. And each year, the research and development industry is investing 55 billion. That's a lot of money. That's a lot of money, and patients are waiting for that money to translate into better therapies that patients urgently need. Now, for this money, we compete every year, every day with other places in the world, like the US, like China. But I do think Europe has a lot of good things to offer, as we heard. Excellent science. We have a clear pathway of EU policy, EU legislation to make regulations more accessible. We have medicines that come faster. And we can have sort of a system that actually rewards innovation and sort of also pays for performance in the long run. So that's something I'm excited about. Europe needs to act. And so for me, the real burden of healthcare and the real burden of the economic impact of healthcare is not about funding innovation. It's actually about failing to do so, because we don't realize the benefits of the money that we invest for better patient care, for the societal impact, and also for the economy. And if you roll up these numbers from various angles, you can say $1 invested in healthcare returns $2 to $4 to the society.
Great. Professor Kanavos, I'd like to take the discussion somewhere else. You know, we are discussing about innovation, deregulation to a certain extent at least. And I would like to ask you if, you know, Europe can strengthen the competitiveness in this field without compromising the sustainability and equitable access to health system, health services.
Yeah. Okay. First of all, thank you for the kind invitation. What a wonderful venue this is for the third summit of SFEE. I was actually planning to speak in my own mother tongue, but I realized that my fellow panelists have no ability to understand what I'm going to say in English. So I'll happily switch to English. I'll continue in English. About 2 years ago, less than 2 years ago, Mario Draghi published a report on the competitiveness of Europe. And I think it's important to take a moment and reflect on what he said in that report, which was a confluence of thoughts and ideas by many colleagues, economists and non-economists, from different universities and stakeholders from across the European setting, but also more broadly. And he said that Europe has a gap in competitiveness, and I think that gap needs to close. Obviously with the United States, but increasingly also with China. I think it was earlier mentioned that China has a lot more publications compared to what they used to have and so on, but the same happens nowadays with patents, which is one very important metric. And I think Europe is coming down in the league of entities, global entities that invest in R&D. So it used to be second, the United States. Now it's a third. So I think we need to reflect on what we can do, and I think one of the suggestions there was to invest very heavily, and that means investment obviously from the private sector, but also from the public sector, and that public sector investment can come through reduced fragmentation. So it's the responsibility of the member states, but also the responsibility of European institutions to end the banking sector and the VCs and so on and so forth, to undertake that responsibility and also contribute more positively to growth, to investment in research and development, partnerships, university industry collaborations, and so on and so forth. So I'll come to the next part of your question, which relates to healthcare financial sustainability. And of course, there we're talking about healthcare systems. And healthcare systems are characterized by certain inertias. And I think the first priority that we have as decision makers, but also thinkers in healthcare reform, is to reduce those inertias. I'll mention one particular concern that I've been talking about ever since I was a junior lecturer up in London, and that was the lack of risk segmentation or risk stratification. So healthcare systems are characterized by a lack of ability to stratify risk. Now, this is very important, and of course, and I'll mention that in just 1 second, but it's important for us to reflect that we need the tools to identify and assess risk, because with that, we can also identify patients with high risk. Patients with high risk are responsible, not because they want to, but that's life, are responsible for the biggest chunk, the biggest part of the cost of healthcare systems. So having identified those patients, we can calibrate healthcare and healthcare reform, and we can tailor treatment to those patients, whilst at the same time, we also have the ability to reform the way that our doctors and our hospitals are paid. If we are to achieve part of that, not in its entirety, then we will create the fiscal space in order to uptake further innovation, in order to have more viable and sustainable systems, in order to target healthcare and improve quality of care for our patients, and at the same time, therefore, be in a position to have sustainability, predictability, quality of care, but also equity, which is a fundamental pillar of our healthcare systems. Does that address your comment, your question?
I would like to have a follow-up question. If you have examples of countries that probably are closer to having a better.
There are several cases of being able to have integrated care pathways, for example, in diabetes, or integrated care pathways and population health in the secondary prevention of heart disease. We have some of these cases, some of these examples in the UK. We have some of these in Italy, for example. We have some of these cases in other European countries. What we need to do is transition from, let's say, a piecemeal or perhaps even disease-specific approach to a much more macro level at health system level. Because let's face it, new money in healthcare is unlikely to come. So we have to redistribute our resources more effectively and more efficiently so our healthcare system can become more productive by calibrating care where it is most needed.
I'd like to return to Ms. Small and take the discussion to biotechnology. Commission is now proposing the new Biotech Act to support innovation and reinforce industrial capabilities. And is this enough so Europe can compete on the global, let's say, race to become possibly a biotech leader?
Thank you for the question, and really interesting reflections by the other panelists, which perhaps already answers a little bit your question in the sense that it will never be enough right now because we are lagging behind, and it is important to have the right legislation to push. So I think it's a concerted effort at the moment that we need to do through healthcare systems, as we heard, the research base and the right legislation. So one of the previous panelists mentioned how slow legislation in Europe is to come to fruition. Hopefully the Biotech Act will be a bit faster. I think it's a good opportunity, but it has to be more ambitious because of the gap that we have with the rest of the world. I think it risks being incremental instead of being completely disruptive, which is what we need right now. And interestingly, what we did as an industry was do a quick socioeconomic study, a benefit study, to see what could different scenarios than the one that has been proposed by the Commission bring. And when we looked, because the current proposal has an extension of intellectual property, which is perhaps one of the first times I see that in Europe in the last 20 years, which is a great step forward. But we looked at how this extension would be afforded, and it's a very narrow eligibility criteria. It's a very narrow scope, and so we studied different ways to make sure that such an extension could actually bring value to Europe. And what we found is, if you have a less narrowed extension design, so a more ambitious one, if you like, you could increase the R&D investments by 11 times. So you'd go from the current proposal, which is about 4 billion investments in R&D over 15 years, which is not a lot, to about 45 billion for Europe, which is substantial. It's what we invest every year in Europe, but okay, let's look at it as a positive. But you'd also have 10 times more clinical trial opportunities. So at the moment, in the current proposal, you'll have about 2,000 more patients doing clinical trials, and with a broader scope and more differentiated eligibility criteria, you'd have 24,000 patients enrolled in clinical trials. And you'd still have a rather limited impact on the pharmaceutical budget, about 0.5% annually throughout Europe. So I think here it's important that we really look at closing the gap. And if we can close the gap with the Biotech Act, not only on the IP elements, which is this supplementary protection certificate, but also on the clinical trial simplifications that are proposed in there, we could really increase not only the number of patients, about 160,000 patients, according to what the proposal is putting forward, but we could also give something back to the European economy, because of course clinical trials are also an investment from industry, and an outcome of those clinical trials will be improved health. And more medicines originating from Europe, which is also a concern right now when we see China last year beating not only Europe, but also the US in terms of new molecules coming from China. So we would have, with an improved clinical trial environment in Europe, we'd probably have 100 more medicines originating from Europe. So I think here the conclusion is, it's an opportunity, the Biotech Act, but it needs to be ambitious, and it needs to be at the right scale to help close the gap and face the new reality, the geopolitical context in which we operate. So we need to be a little bit more ambitious than we have been. Just think we have a few months while the different European Parliament and the European Council discuss the proposal, and hopefully what we will get in the end is a stronger tool that will give more to patients and more to the economy as well.
Mr. Shiver, this means, in general, I gather from our discussion here that competitiveness, so the strengthening of competitiveness and access to better therapies is not mutually exclusive.
Definitely not.
We have
if we build on really having a broader and stronger clinical research in Europe, the whole purpose of what we do is eventually to serve patients. There is no, you can invent all the incentives you want. The biggest incentive is when we eventually discover something that brings value, make it available. And make it available, and Professor Canaval said something extremely important, make it available to the right patient by really working through clinical flows in order to drive best outcome. Because one of our issues, and we know it, is that we have waste in the system, generally. Now, access is paramount, because if we want to have a dynamic where we're going to be competitive from a research, there's no way to do research on any new molecule, new mechanism, if you're not able to compare to what will be the standard of care. And we now have an increasingly number of countries in Europe that don't even use the standard of care because of delayed access. So how can leading investigators do research if they don't have available what today is the standard of care? So those don't go in isolation. Access is, I would say, foundational to really being able to build a sustainable healthcare system, and eventually and have a Europe that is competitive. And there are a few things here that we can accelerate. There's a European health technology assessment. One of our issues, again, to fragmentation, which is the theme of the morning, I mean, each member state assesses value differently. If we could have all member states look at clinical value with the same framework, that would be just a huge change in the ability to speed access. The second is, how do you look at better assessment of value? At the moment, our systems are relatively classical and conventional. The chance we have with digital and real-world data is to be able to assess value continuously based on real-world impact and start having healthcare systems and payers pay for what really works and pay less for what works less. So there's a need to really reform how we assess value and better connect that. The third is bring together the stakeholders and really assess integrated care pathways. I think we're still thinking through value as the value of each interventions versus trying to recognize the value of more integrated interventions with multiple stakeholders for better outcomes. So this is where, you know, I think Greece has an opportunity maybe to step back and say, hey, I'm in an impossible situation where I've set a maximum that I can spend, and therefore we're in a situation today where we have the industry itself paying for a significant part of care, more than half. How do you move away from this system and move into a system where let's redefine what is the value that is being brought, and let's leverage the data? Greece has put a lot of investments on building data infrastructure. They have a much better understanding today here in Greece of what is being paid for. Mm-hmm. Let's connect what is being paid for with what is the outcome of that payment and start having different discussions.
So this would be the same question for both of you. First Mr. Black and then Professor Kannavos, please, you can come back on that. And my question was if Greece, actually, since we're here in Greece, can do something to attract more investments in clinical research, research and development. Can it do something specific?
Yeah. So I'd like to build on the themes that we have heard from the colleagues. I think one is around the Biotech Act, which I think is a very strong first step. I completely agree with Natalie Moll. I think let's keep a high ambition, and I think it's a unique opportunity with the upcoming presidency of EU presidency in Greece, to play a leading role here. So that's one, and I think that will play down to the local implementation as well. The second element, anything that we can do to accelerate life-saving medicines, important new medicines reaching patients faster, we should do. So definitely whatever we can do in order to come to a faster decision on regulatory but also reimbursement is the right step to do also for Greece. The clawback or the mandatory rebates that we are paying as an industry are the highest in Europe. And for an industry, this is not sustainable. And we expect, as the numbers for 2025 are emerging, that overall, by end of the year, they go significantly down and go down to the levels below 2024, and eventually, over time, completely vanish. It's in the spirit of what my colleagues are saying. We come to a system that rewards innovation, where we create the fiscal space, to provide the right medicines for innovation, for generics, what is needed for the patient in order to treat health as an investment and not as a cost item.
I think Minister of Health will be here shortly, so he may have something to say about this. But Professor Kannavos, you had a comment, and please, your answer on the Greek aspect.
No, of course. I think there's a lot to say, because at the end of the day, the users of innovative medicines, innovative health technologies are the patients, and obviously the funders are the healthcare system. So we have to find the right balance. So reflecting on the Greek setting, what we need is better, more efficient oversight. I think there have been a lot of steps in calibrating and improving the way that technology assessment works. We recently had the completion of the project on alignment of the country's process with the HTAR, the Health Technology Assessment Regulation, and obviously the negotiation committee and so on. I take the point. I think the paybacks, or most usually known as clawbacks, are very high in Greece. But at the end of the day, we are practically reimbursing nearly everything that comes into the country without much constraints. Other nations that have got a more effective use of the health technology assessment tool are imposing significant restrictions in the utilization of those technologies. So I'm afraid there's no, let's say, magic bullet in that particular context, recognizing obviously the constraints. But coming back to my earlier point about fiscal sustainability, I think there's a lot that we can do in exploiting the digital agenda and better use of data, which I don't think we are doing, not only as the Greek state, as the Greek government, or as Greece in general, but also as a collection of countries at European level. And yes, I would definitely be in favor of greater use of real-world data and real-world evidence. Clearly, from our perspective as academics, we need better methodologies and better applications, but I think there are ways to overcome some of the constraints that my friend panelists here mentioned earlier on. And I think this is the way forward. Clearly, a lot of time issues, but effective, efficient oversight or regulation, and calibrating care to where it's needed most. I think this is a significant gap that we have, and we need to improve upon.
So thank you everyone for this amazing discussion. It was great.